Dr. Jenny, congratulations on being the first country to undertake subnational level verification on the interruption of transmission. Could you please elaborate on the steps taken by Maldives to achieve these milestones?
The Maldives journey, while reflecting, our work towards achieving this milestone in 2023 is built upon the foundations laid by the healthcare workers who strive tirelessly with a strong will by our communities. This effort gained momentum in 2019 when we became the first country to launch the Zero Leprosy Framework. It's a cornerstone of this success. We have had rigorous training for our healthcare providers, capacity building training of trainers across the country. And as you know, Maldives is a small island nation. Our islands are dispersed, so the trainings had to be engaged in the capital first and then rolled on to the other islands to make it sustainable. Additionally, we had specialized training for our other healthcare providers, to the laboratory technicians, the physiotherapists, to enhance diagnosis, treatment, and patient care to ensure a holistic approach towards treatment. And then there was extensive screening rolled out. Leprosy being a disease with the stigma around it, we had to have awareness campaigns throughout the islands, aiming to identify new cases, providing early diagnosis and treatment and chemoprophylaxis. So our target to eliminate leprosy by 2030, it includes several strategies. So looking into the future, we are intensifying and further strengthening our efforts for surveillance, for early detection, and to facilitate diagnosis of new cases early, which would be done through regular screening campaigns across all islands with a key focus on identifying sporadic cases. Additionally, providing chemoprophylaxis to contacts as a preventive measure to sustain our efforts. Further engaging with the community is I believe it's a cornerstone for us. So, and a robust monitoring mechanism is essential to understand the implementation, the process, like how are we moving forward and what do we need to change while going ahead. Going forward, I think we must ensure our health workforce continues to be empowered because we have reached so far, but we have to move ahead still.
We know that the disease can also be prevented. Could you elaborate on this strategy and the role of WHO in supporting member states?
Thank you so much, Amelia. In 2018, WHO came up for the first time with a guideline on diagnosis, treatment, and prevention of leprosy. One of the recommendations which were put forward was about use of single-dose rifampicin for post-exposure prophylaxis. This strategy is found to be safe, it is acceptable by people, by communities, and it is effective. It leads to almost a 60% reduction in the risk of disease amongst the close contacts of patients with leprosy. What WHO is now looking at, working with partners, we are looking at scaling up the post-exposure prophylaxis with single-dose rifampicin. And I'm very glad to inform you that we now have donor commitment by which we can actually enable a global scale-up through procurement of rifampicin, and WHO would very soon start, along with multi-drug therapy, which is being provided by WHO, distribution of single-dose rifampicin also to the countries.